Implants have changed a lot over the years. One of the things that we are seeing more now is that the implant companies are filling the actual implant shell more than they used to in the past. And I think that's a good thing. It gives more of a full look in general, and also can help with some of the rippling and things like that we were seeing in the past also. And also there's more sizes and more of a variety of profiles to choose from. We have more options than we used to in the past, and now we have different types of gel too. A lot of the gels we're seeing now are a little bit more cohesive, and what that does is it helps the implant keep its shape a little bit better, and it gives it more upper pole fullness for some patients. I think the main benefit for silicone implants is that it feels more like breast tissue. It has less rippling, and it's not as palpable. The disadvantages is if a silicone implant ruptures, you can't tell by just examining the patient. Right now the standard is MRI to look for a leak of a silicone implant. The advantages of a saline implant is that if it leaks, you can tell clinically just by examining the patient. The downside is that it can have more palpability, have more rippling, and it doesn't feel quite as much like breast tissue. So yeah, the concept of CCs can be confusing for people because, you know, as an everyday American, we don't measure things in milliliters or CCs quite that often. I tell patients that 1 cup is approximately 240 cc's. That's one way you can sort of conceptualize that. It's easy to get hung up on a number, and some patients already have a great idea of what they would like to have before they even come in. But there's those that don't. So I try to tell patients, just because that size implant worked well for their friend doesn't mean that's going to be the right implant for them. It doesn't mean they're going to get the same result. Everybody's a little bit different. Everyone has a little bit different shaped breast, and some people come in with more volume already and others have less. There's 2 basic planes you can place the implant in. You can either put it above the muscle, which we call subglandular, or below the muscle, which we call submuscular. One of the advantages to placing the implant below the muscle is that your capsular contracture rate is a little bit less. One of the downsides is that everyone has a pectoralis muscle. When you flex that muscle, it can actually cause the implant to move a little bit. We call it animation. It's usually not very noticeable, if noticeable at all, but that's something that we always talk to our patients about. One of the other advantages to placing the implant below the muscle is that if you don't have a lot of breast tissue, you have more coverage for the implant. So it can decrease your chance of having palpability or having rippling, or having that augmented look. One of the advantages to place the implant above the muscle is that you don't have to worry about animation. The capsular contracture rates are a little bit higher above the muscle. Vectra is a digital imaging software system that we use to basically give a patient a 3D visualization of what they want to achieve with their breast augmentation. It's a series of cameras that takes a picture and it creates a 3D rendering on the computer screen of yourself, and what it creates is almost a digital avatar of what you can expect when you have a breast augmentation, and it can take measurements, can also make recommendations for the implant. I can also point out things that sometimes the patients don't notice about their own anatomy too. So I think it's very helpful. The patients love it. They think it's, you know, very helpful for them to be able to visualize what size they're looking at prior to actually having implants placed.